Good day, everyone. We are going to do subcutaneous injection. Please note, you must always know the action, special nursing consideration, safe dose range, purpose of administration, and adverse effects of the medication to be administered. You must note that the basic principles in medication administration must always be maintained by covering the 10 rights and 3 checks. 10 rights: right patient, right medication, right dose, right time, right route, right education, right to refuse, right assessment, right evaluation, and right documentation. 3 checks. The first check is when the medication is pulled or retrieved from the appropriate medication cupboard. The second check is when preparation of the medication for administration takes place. The third check occurs at the patient's bedside just before medications are given. This is also an outstanding opportunity to educate the patient on the medication. Always complete your assessment before administering medication. Gather equipment: sterile syringe and needle, sterile swab, small gauze, doctor's notes, nurse's notes, and appropriate PPEs. Perform hand hygiene. Place the medication cart in front of the patient's bed, also making sure you are facing your patient at all times. Note: always prepare medication for one patient at a time. Identify the patient using 2 methods: using your nurse's notes. Check the name and date of birth on the patient's identification band.
The patient was identified previously. The assessment was also done previously. The patient has no allergies, and the medication was prepared using the 3 checks previously.
Ask the patient to state his or her name and date of birth based on hospital policy. Check the patient allergies on bracelet or ask the patient about their allergies. Discuss the various sites for administration of subcutaneous injection.
Some of the sites for administration of subcutaneous are the forearms, the abdomen, away from the umbilicus, and the thighs. We are going to be using the thigh today.
Select an appropriate administration site. Assist the patient to the appropriate position for the site chosen. Cleanse the area around the injection site with sterile swab. Remove the needle cap with non-dominant hand, pulling it straight off. Bunch the tissue around the injection site. Hold the syringe in the dominant hand between the thumb and the forefingers. Inject the needle quickly at a 90 degrees angle. After the needle is in place, release the tissue and administer the medication. Inject the medication slowly at a rate of 10 seconds per milliliter. Withdraw the needle while supporting tissue with your non-dominant hand. Use a gauze, apply gentle pressure to the site. Do not massage the site. Never recap needles. Place needle in the appropriate receptacle. Assist the patient to a position of comfort. Perform hand hygiene and document. And that is the end of subcutaneous injection.